So I'll go ahead and get started. And again, we will get to questions after the presentation. Again, thank you so much for being here. I know that this is a very busy time for you on a Monday afternoon. So we should get through this presentation within about 30 minutes, and then we'll have enough time for questions and answers afterwards. You're going to see this next slide is a little busy, but what this slide tries to depict graphically is the bulk of the nursing major courses in the program. And if you follow the screen on your left upper hand corner, you'll see that the foundation courses, chemistry and statistics, are listed. Most of the nursing students come in with perhaps chemistry, maybe not. If they do not have chemistry, they usually take that within the program before they get to the pathophysiology course. Many students come in needing statistics, and that's offered as well at Ottawa University online. Then we move into the nursing major courses that you see that are cascading down the left-hand side of the screen. And what we're concentrating today on are the two courses, community-based nursing and nursing leadership and management, that are highlighted there on red with the arrows pointing to them. Those are the practicum courses in the program. Usually they are placed within the second or third from the bottom of the program. So depending on where you're at in the program, you can actually look at your individual degree plan that you developed with your academic advisor to give you an indication of when those will be coming up for you. Most of the time, the students take the community-based nursing course prior to the leadership. That's usually the way the courses are sequenced. I say that, but there are times where the students need to take the leadership prior to the community-based nursing course, just based on when the schedule is available to them. So there may be some of you that will take the leadership prior to the community-based nursing. But just be aware of where those two courses are in your individual degree plan, and just kind of keep that, keep track of that in your mind so you'll be prepared for those two courses when they come up for you in the program. So when we talk about practicum, what do we mean? What does this word entail for us in this particular program? Well, a lot of students think that they're clinicals, and really they're not clinicals in the sense that you accomplished or experienced in your associate degree or diploma nursing program. What they are is what we call practice experience opportunities, application-based projects, or practicums. We use those similar terms when we describe these projects. In these two courses, Nursing 46006 and 46009, they can be accomplished at your place of employment, not in your current work setting where you're assigned, for instance, in your specific unit or department, or within a local community healthcare setting. And we'll talk a little bit more about that here in the next slides, but just to give you a broad sense that these are not clinicals that you typically accomplish in your ADN program. You've already met those requirements. These are project focused. So why do we require such practicum or practice experiences? Well, our accrediting body, the Nursing Specialized Accreditation Body that recognizes us, is called CCNE, or the Commission on Collegiate Nursing Education. And in order to meet their standards and their accrediting stipulations, we need to maintain the rigor of the program, even though this is an online program, to include these practice experiences in this program, because we know as RNs that nursing is an applied profession. It's very hands-on. So in order to meet those requirements, we've accomplished that in these two particular courses. So students also ask the question, how many hours are required to meet these practicum expectations? Well, there's not specific hours, like a set amount of hours that you need to clock or log into to meet these requirements. How you meet the requirements are in this particular program. Now, there are some programs out there that do require a set amount of hours. For instance, some of them will say 120 hours of clinical or practice experience. That's not the case in our program. But what we do require is that you spend the amount of time that is necessary to accomplish the outcomes or objectives of that particular course when working on this particular project. Now, I do have a disclaimer at the bottom of your screen. There's a lot of words on the screen, so I'll just kind of paraphrase that. But I do want to make note that this course, these two courses, just like any other course in your nursing program, is an 8-week course. So it's no different than any of the other courses. You will log on to Blackboard just like you do currently in your other courses. So in that regard, it's the same. But when you're looking at thinking of a project to work on, to focus on for these two courses, you want to think of a project that's realistic to manage in an 8-week time frame. Now, that said, there are some students that have chosen projects that they've started and implemented in the 8-week course and maybe finished later on in their respective place of employment. But, that's probably the minority of students. If I were you, I'd think it's something that's more realistic to accomplish in that 8-week time frame. Again, this is a learning experience. We're giving you the stepping stones, the foundation to develop these project ideas, implement them, and do some evaluation of them during this course time. And then later on, this helps you, gives you the framework, the foundation that you can accomplish these projects later on in your profession as a BSN nurse. So when should you start preparing for these practicums? Well, it again depends on where you're at in the program. I know some of you may have just started, or some of you may be only through the program halfway, but I would say that the sooner that you start thinking of ideas about these particular projects and these two courses, I think that's the sooner the better. I think it gives you a more meaningful experience once you get into those courses, and it's less stressful for you to better prepare. I would say that at a minimum, 2 to 3 months before the start of the term, where you will have those two courses scheduled in your program plan. Because there's some forms, et cetera, documentation that needs to be submitted to me prior to approval for those projects to begin. So with that said, how should you start to plan? Well, I think a good way to get started is to actually look at the detailed information in your practicum handbook. And where you find that is if you go to your student portal, and I think most of you have been there and you know where that's at, looking at the screenshot that I have on the slide in front of you, go to the student tab that's highlighted in red. On the left-hand side of this slide here, you see that student menu. If you scroll down to Student Info Center, second to the bottom under that heading is Student Handbooks. And if you follow that red arrow that I have on the slide there, where it says Nursing Practicum Handbook, that student that's highlighted in red there, font with red, you click on that, And this green Practicum handbook comes up in a PDF format once you click on that link. And this is our student guide for the practice experience handbook. It's pretty detailed, and it gives you kind of a recipe to follow in order to get started on these particular projects for these courses. So I think that's a good way to get started reading through that, especially if you have a ways to go before you hit these courses. At least you can have this on your radar and have a good idea of what questions to ask prior to getting started. So another caveat here in regards to planning that I want to point out is that myself and your academic advisor, we have of course, your plan outlined, and we know when you're going to be taking these courses in the program. So we will be sending you notification via email. Normally, that'll probably come from me, and I have a screenshot of a pretty typical email that will go out to notify you, usually about a month or two in advance of the start of that term with that practicum course. So when you see these email notifications that are coming to you, please do not ignore them. They come to you obviously on your student account email at Ottawa University, and they will kind of give you the heads up of, hey, Kathy, you're scheduled for Nursing 46006, Fall 1. We need to get started on getting these forms submitted. So we'll also be notifying you via email as well. So again, that will give you further instructions to look at to help you get started. Another way to begin to think about a project plan for these two courses is to look at the course descriptions. Now, in front of you is the course description for the community-based nursing course. That's 46006. And remember, I said that that course usually will come first, for the most part, for the majority of students before the management course. Now, when you look at it on the screen, the course examines health issues, disease prevention, and current trends in public health within diverse urban and rural settings. Topics include evaluation of evidence-based nursing and various epidemiological principles to develop an effective understanding of the role of the professional nurse in the community setting. Okay, so reading this, we know that we're going to be working on a project that's geared towards community public health nursing. So I always tell the students what to kind of think about to help kind of spur some ideas for you is to think perhaps of a passion that you have in this area. Now, regardless of whether or not you work in this particular field right now in your nursing career, all of us may have some type of passion that we have in regards to community or public health nursing. Perhaps maybe you have a family member that's a diabetic and you want to do something in regards to providing more effective diabetes education in your particular community setting. Maybe you're an asthmatic and you want to provide more educational tools for healthcare providers who come in contact with asthmatic patients. So again, just giving you some ideas. Think about a passion of yours or a particular interest, and maybe that will help you think of a project that you want to tackle in this particular course. Now, on the next slide, I have about 8 different examples here. Again, ideas only. There are millions of them, actually. I mean, there's so many different ideas that you can do for community and public health. I always like this one idea. I think it's just a cool idea that someone brought to my attention. Number 3, if you think about, how we have health awareness months National Health Awareness Month, particularly we're very familiar with October being Breast Cancer Awareness Month, November is Diabetes Awareness Month. If the term for this particular course falls in a month of interest to you, for instance, okay, August is National Immunization Awareness Month. Like, I hope you're getting the picture, but maybe like if the course falls within that particular month for you, you might determine that you want to tackle a project that is in conjunction with that health awareness month, that observance month for that particular term. So you might want, if the course falls within October, you might want to do something on breast cancer awareness. So I'm just kind of rambling on here, but trying to give you some ideas to help you kind of think about where to get started. The next course is the Nursing Leadership and Management course that I brought up earlier. Again, think about a particular passion perhaps in leadership management. Here's the course description. The course utilizes theoretical principles of management to provide the student with the foundation to become an effective change agent, leader, manager in today's complex healthcare setting. Topics include strategic planning, quality improvement, and organizational and system leadership. Okay, when we talk about leadership and management, we know that those are two different separate definitions. For instance, you know, when we think sometimes of management, we think of specific positions like charge nurse, supervisor, director, manager. When we think of leadership, we are all aspiring to be nursing leaders. That's what we aspire to become in our profession. So you can be a leader in the clinical setting just as effectively as being a leader in the non-clinical or administrative setting. So thinking about that as a nurse leader, what are some particular topics of interest to you? Again, it can be in your clinical setting or not so much in your department setting, but in another setting within your hospital or healthcare organization. Maybe it's a quality improvement initiative. I have a list, I only have 4 here of particular examples or ideas that might help you get started. I think most students are able to accomplish this practicum project within their employer setting, not again within your department that you're assigned, but somewhere within your organization, because most organizations have leadership and management project potentials. So I think a good way to get started with this particular project might be to reach out to not only perhaps your nurse educator to ask her or him of a particular project that you might be able to get involved in your organization, but perhaps your charge nurse, nursing supervisor, nurse manager, or maybe even your CNO. So look for direction, maybe network within your organization and find out if there's any opportunities to work on a quality improvement project perhaps in your organization. I like this number 2. Working, it's a cool idea as well. I would have never thought of that someone brought up. Most of us are using EMR in our clinical settings. Maybe there is a specific template that you use for documentation or that is used in your facility for documentation that you would like to contribute some input on as far as perhaps a revision or perhaps maybe even a new type of template to document on within your institution. So you might want to look at reaching out to the clinical informatics team, and that could be a project that you work on. So again, lots of ideas. The students that have worked on these projects in this particular course were able to network within their organization, and some of them were actually able to look at positions later on after they graduated because, the opportunity for other positions because of their ability to network within their organization to work on these particular projects. So it's a cool endeavor to consider in your organization. It might help you actually later on in your career as well as you meet, others from different departments. Other things to think about with planning for the practicum. I think this goes without saying, but I do want to emphasize that you need to, of course, accomplish these projects within the state that you're licensed at as an RN. Also, if the organization requires a separate formal academic affiliation agreement contract, they'll let you know if they do, believe me, then I need to know about that. So please send me that contact information and I can get the ball rolling on the backside with getting that agreement signed with Ottawa University's legal department. I just would need to know who to contact to get that started. Not all institutions require this. I would say probably your larger institutions do require this. So it just depends on the organization if they require a separate contract that they have in place with their legal department. So just let me know. I'll do the legwork. I just need to know how to get that going with who to contact. Finding a preceptor is going to be important. Now, I did mention that you'll be taking this course online with the instructor who will be facilitating and guiding you throughout this course, but you will need a preceptor that is assigned to you on ground at your location to help champion you through this project as well. And this is, again, our accrediting body's stipulation, so we follow their requirements. You'll need a preceptor who is a clinical or managerial leader who has an earned BSN degree at the minimum. So it can't be a nurse that's currently pursuing their BSN. It has to be a completed BSN or higher as a preceptor. We have made exceptions on a case-by-case basis to utilize healthcare professionals other than nurses as your preceptor. It just depends on your particular project. So again, we would just have to take that on an individual consideration. You'll also need to begin thinking about obtaining your student ID here at Ottawa University or badge if you haven't done so already. And that can be accomplished by reaching out to your academic advisor. And there's a screenshot on the slide of the form that needs to be signed by you and submitted to the advisor. And you can just reach out to Julie or Katie, whoever your advisor is, and say, hey, I need a student ID, and they'll send this to you. They'll let you know how to get that started as far as submitting your photos so that they can make the ID, and they will mail that to you. You do not have to come physically to any of the Ottawa University campuses. But anytime you go into an organization, you need to represent yourself as a student. You'll need to use our identification. Now, you can't work on these projects in your place of employment on work time. This has to be on your student time. I think that goes without saying, but again, I wanted to emphasize that. Also, we'll need any updated information, your TB skin test, your BLS card, your RN license. We need to ensure that we have the most current information that is in your student file at all times, but especially it's very important at this time when you're going into these outside organizations. I'll remind you of this when you get closer, but in any case, anytime you have an update, please just take a photo of it and send it to me via email or scan or fax it to me. We are, and I know we're talking about emails, and we're trying to get away from that. We are presently working on a system where we're going to streamline all this into Blackboard, where there will be a link that you will submit your project idea, proposal, and all of these forms, etc., to this particular link. We'll let you know when that's established. We're in the process of working out those little bugs. And as soon as that is available and you can access it, I'll let you know. In the meantime, just feel free to send the emails to me, for instance, your project proposal. Send it to me and I'll ensure that the instructor for that particular course reviews that and I can get their input as well. Your instructor for these two courses is normally, the lead faculty is normally Professor Norma Wolf, and she will be the one that will likely be reaching out to you as you get closer as well.